This segment of the news has been brought to you by Sun Oil Limited.
Welcome back. An amendment to the Mental Health Act is on the way, this much coming from Minister of Health and Wellness, Dr. Michael Darville, before the weekly cabinet meeting. His comments come off the heels of a young mother being shot to death by the father of her child over the weekend. News of the fatal shooting has sparked outrage on social media, with renewed calls for an end to violence against women and calls for mental health to be taken more seriously in the Bahamas.
Well, mental health is a serious situation in our country, and we are about to bring to Parliament the new Mental Health Act. It gives us more teeth and more tools to be able to address a lot of the mental issues that exist. We all live in the community, and we drive from place to place. As you drive from place to place, you're beginning to see it visibly. You see individuals that clearly have mental disturbances on our streets. And I believe for us at the Ministry of Health, we must be able to address the issue of mental health in the country more effectively. And the first avenue to do that is the amendment to the new mental health act.
When asked when the public can see this legislation tabled, Minister Darville says this.
Well, we are now looking at the final draft. I definitely have to get more consultation on it, but I would like to do it sooner than later because I believe the issue of mental health is a serious issue in our country. And I'm not pleased of what I'm seeing in our communities as I move from place to place. And some of these instances with violent crimes, there's always a possible undertone of some mental disturbance.
Dr. Darville has gone on record in the past to say that there is a lot more work to do to address mental health in the country and has described the current Mental Health Act as a dated piece of legislation. 42 of the 50 specialty nurses from the Republic of Cuba are now officially a part of the cadre of healthcare workers at the Princess Margaret Hospital. Nearly 2 weeks ago, the Cuban nurses arrived in the capital to augment the nursing shortage that the country's healthcare facility is seeing due to the many nurses being out of the system because of exposure to COVID-19. The Public Hospitals Authority says those nurses joined the staff at PMH on Monday, beginning a 3-month tenure, and have been deployed to the PMH Emergency Department, the Surgical Department, and the hospital's medical wards. The nurses are on board to assist in the delivery of hospital services and patient care in the face of the impact of the fourth wave of COVID-19 infections on health professionals in the public health system. They were received at the hospital's historic legacy entrance by the Minister of Health and Wellness, Dr. Michael Darville, PHA Deputy Managing Director Lyron Burrows, PMH Hospital Administrator Mary Lightburn Walker, Principal Nursing Officer Charlene Davis, along with other PMH executives and nursing managers. Dr. Lorenzo Sanchez, the Cuban Health Professions Liaison Officer between Cuba and the government of the Bahamas, was also on hand for the nurses' arrival at PMH. Ground transportation for medical emergencies need major improvement on the Family Islands. This much coming from Health and Wellness Minister Dr. Michael Darville on Tuesday ahead of the weekly cabinet meeting. This follows a traffic fatality on Long Island over the weekend, which claimed the lives of 3 young men.
As Minister, I visit all the clinics throughout the Family Islands, and I can say unequivocally that something must be done. I believe the days are gone when individuals who are in any sort of traumatic event is placed on the back of the truck and trying to get to the facility or get to the airport. I believe we must do better. I think we must find a better way for emergency medical services on our Family Island. And as a matter of fact, we intend to bring a paper to address that, address the manpower shortages at our clinics. I visit the clinics, there's no handyman and a lot of things that need to be done around the clinic, preventative maintenance. All of these things are necessary and we're moving in that direction.
Asked how soon we can see those improvements, the health minister says this.
Well, one of the criteria for infrastructural upgrades in the Family Islands at our clinics is tied in with an IDD loan. We are in the process of activating the parameters of that loan. And resources will be provided through that loan facility to improve our clinics and look at the manpower resources as well as the physical plan and get them to a standard that they feel is consistent with what we need to provide throughout the country.
In the meantime, Dr. Darville says health officials are looking at the air ambulance situation. He says they believe that there is a lag time coming from New Providence and that must be improved. Since the spring of 2020, public school students have been forced into uncertain circumstances as the government tries to balance public health safety and the importance of education for young children amidst a global pandemic. As schools reopened for in-person learning on Monday and yet another semester hampered by the COVID pandemic, how should students prepare for major exams? In this report by Dorino Saunders, a senior educator addresses this issue.
There have been reports suggesting thousands of students have not had any form of schooling since the spring of 2020, as the virtual learning platforms have not had the desired impact for any number of reasons, including a lack of electronics and data and no responsible supervision at home for students. Earlier this week, we asked Dr. Bridget Romer, the principal at A.F. Adley Junior High School, how will students who have not attended virtual classes or any classes at all prepare for exams like BJCs and BGCSEs?
Well, our students are going to have to be prepared to put in some extra time. Even though we are putting some stuff in place in terms of we have the enrichment classes that we are going and intervention classes that we are offering, that all the schools are offering to help them, they have to also be prepared to put in some extra time at home, all right? Especially those who were riding their bicycles the entire time and whatever else they were doing but not reporting to school, not completing assignments. It's going to have to be a two-way street.
Dr. Romer congratulates those parents who have ensured their children continue to do their schoolwork during the pandemic. She believes for those students sitting external exams like the BJCs and BGCSEs, their parents will have to play a vital role if they are to be successful.
Parents are going to have to work along with us, and they're going to have to be responsible to make sure that their children are sitting to the table in the evenings, completing assignments, studying as we prepare. And BJC is not that far away, and it covers 3 years of material. So our students should have been reviewing all along now to prepare for this exam, because you can't review in a month 3 years of work.
Dr. Romer admits it is going to be difficult for those students who have not made the effort to keep up with schoolwork, but she says it is still possible for students to achieve good results should they put in the time and effort to study and review coursework and assignments.
So there should have been some kind of study timetable, which we always been promoting with our students from the very first time they come into school. When school first open up, we say set up a timetable, a study timetable, so you can put in some time, even if it's only 30 minutes on a particular subject, 2 subjects a night, so you could start reviewing the 3 years of work in preparation for the BJC examination. So it has to be a partnership with us and the home, so parents have to do their part.
In August of 2021, the Ministry of Education announced an improvement in national BJC and BGCSE exam results, but also admitted many students did not sit the exams. Again this year, the BJCs and BGCSE exams are scheduled to begin in the month of April. Dorino Saunders, JCN News.
COVID-19 cases continuing a downward trend as the Bahamas looks to be at the end of the 4th wave. The Ministry of Health and Wellness confirming 44 new COVID infections on Wednesday. On New Providence, 22 cases were confirmed, 8 new cases on Exuma, 7 on Grand Bahama, 5 on the Berry Islands, and 2 cases on Cat Island. Total confirmed cases now at 32,282. 7,308 of those cases are active. 145 in hospital, 9 in intensive care fighting off the virus, with 136 people moderately ill. The COVID death toll remains at 731, with 42 deaths under investigation. 167 people recovered from COVID-19 on Wednesday. Total recoveries now at 24,048. Well, that does it for news this evening. Once again, I'm Tyler Simonet, and from all of us here at JCN News, have a good evening, everyone.
This segment of the news has been brought to you by Sun Oil Limited.